is Gladys, registered nurse. I'd like to take you through reproductive health, basically some knowledge on cervical cancer screening. Okay, let's start first by knowing what is cervical cancer. Cervical cancer is abnormal growth of cells in the cervix, normally caused by a virus known as human papilloma virus. This is a dominant virus that normally resides in the human reproductive organs, mainly in the male and sometimes in the female. This is normally sexually transmitted virus, and the virus can cause cervical cancer in stages where it has advanced. So I'd like to take you through how we can prevent, or how can we be able to detect that someone is suffering from cervical cancer screening. Now, we understand that cervical cancer screening is a method that has been introduced by the government to be able to identify the virus and the cancer at its earlier stages so that it can be prevented. So what do? Now, ladies, it's your turn and your duty to go to this done screening. That means if you're sexually active, however, they say from the age of 16, still if you're sexually active from the age of 14, you can be done HPV screening. That can be able to detect whether the virus has already gotten into your body or you are still safe. That means for ladies that are above 18 years, they can be done what is known as perpendicular test. That means a sample is connected from your cervix under the inspection of speculum. Then the sample is being sent to laboratory. In the laboratory, they will brew the organism. Then if the tests are abnormal or if they are normal, there will be management depending on how the results will be. Now, how do we know that you are liable for treatment for cervical cancer? There are many forms of treatment for cervical cancer. There is cryotherapy, there is thermal ablation. So it depends on the stage that you are in cervical cancer. And cervical cancer screening should be done annually. That means if you do the test in June this year, you are supposed to repeat the test in June next year. But there are chances that if someone is pre-exposed with HIV, the test can be done in 6 months if the results were abnormal. More information will be shared to you if you continue following